As part of Jenna Pothier's battle with a rare type of skin cancer, she underwent 3 extraction surgeries. While removing the tumor from her forehead, the doctors also cut out some of the surrounding healthy tissue. This process helps to make sure all of the cancerous cells are removed and lowers the risk of the cancer returning. Unfortunately, it also left Pothier with a sizable wound on her face.
It was a large area on my forehead, about half my forehead. I believe it was like 8 centimeters by 8 centimeters. I like to compare it to like a hockey puck size.
A wound of this size can't be sewn back together. Instead, patients will get a skin graft. The typical procedure involves cutting healthy skin from one part of the body and transferring it over to cover the injury. But instead of following the traditional path, Pothier's physician, Dr. Ian Valerio, presented her with an alternate option: spray-on skin.
It's kind of like a mister, if you picture it. When you mist in spring in the hot summer weather and you're trying to put some cooling agent onto your skin, that's kind of how the spray skin solution works too. So you mist it on, it allows for a very thin covering, and then we put a non-adherent gauze over that to allow for it to heal. And then after 5 to 7 days, you can then unpackage it or unwrap it, and then the spray skin has already started to actually grow into its new position, and those cells are actually growing underneath that. And at first, it doesn't look like a lot's happening. But then if you give it a few days, you start to actually see the effect as the skin starts to repopulate in the areas where it was sprayed to.
Valerio is a plastic and reconstructive surgeon at Massachusetts General Hospital, professor at Harvard Medical School, and executive officer in the U.S. Navy. Both traditional skin grafting and spray-on methods need to use some of the patient's healthy skin, but Valerio says the spray-on technology can be much more conservative. It can expand a piece of skin up to 80 times its size. For example, if your entire back was burned and needed new skin, the device would only need to take a healthy sample size of a credit card. On the other hand, typical skin grafts often need much larger patches of skin.
Think about the extremities, trunk, abdomen. Those skin grafts could be much larger. It could be a small 2x2, 3x3 centimeter wound, all the way up to something that's much larger, including the entire leg. Or if it's a burn patient, it could be even more than that. So we typically say percent of body surface area that's injured. Each leg is 18%, for example. Your arms are 9% each. So if you think about that, if you add up those areas, it depends on the type of trauma you have. So skin grafts can range from 2 to 3 centimeters all the way upwards of hundreds to thousands of square centimeters, depending on the injury that the patient has suffered from.
The most common donor sites for typical skin grafts are the upper arm, inner thigh, and behind the ear. There are different thicknesses needed depending on where the injury is, but Valerio says the surgeon often needs just a thin piece of skin.
We would use a special harvesting device that allows for us to take a very thin piece of skin from, for example, your thigh is probably the most commonly area where this is taken from. So we would take that, what we call dermatome, that would actually then allow for us to shave a very thin piece of skin off of the patient's body and then transfer that to the area of treatment of need, whether it be a different limb, different area on the same limb, to the abdominal area, trunk area, etc.
For Pothier's head wound, Valerio first attached a synthetic graft before she made her decision between the 2 options.
The original plan was to just kind of my skin naturally grow over that, but that would have taken a much longer time and a much longer healing process, whereas the RECELL spray skin allowed for what we think would have been a better cosmetic outcome and a quicker recovery time.
Since Pothier had just gone through 3 surgeries, she wasn't looking forward to a 4th. Thankfully, it turned out to be a much smoother process than her cancer removal surgeries.
I think part of it was mentally knowing that there wasn't a lot of worry going into it. It was like I had already gotten the all clear that I was cancer-free, so that was a huge weight lifted off my shoulders. And just recovery-wise, it wasn't as bad. It was a little different because they did have to use a small graft site from behind my ear. So I had the additional kind of wound care for the back of my ear as well as on my forehead. But I felt mostly excited about this procedure compared to my other ones. And I was interested to see how the process would go and excited for the process to start happening.
In 2018, RECELL was the first spray-on product to be FDA approved for burns. Last year, just in time for Pothier's surgery, its approval was expanded to treat a range of full-thickness skin defects. And though Valerio says this spray-on technique is often used together with traditional skin grafts, he thinks it will soon become the standard method.
There are a few physicians out there, including myself, that have used this in isolation. It's considered off-label, but we have been actually utilizing this for certain patients with good results. And I do think there could be somewhere in the future where if you have someone with just a superficial to partial thickness injury or conversion of a full thickness injury to a partial thickness injury, where potentially spray skin alone will be enough that you can actually allow for full thickness skin coverage eventually.
There are a few reasons why Valerio prefers RECELL over traditional skin grafting. In addition to conserving healthy skin, the spray-on technology can speed up the healing process of the donor site.
Donor sites are pretty painful, frankly, and they also take their own time to heal. You can apply this back to the donor site to actually allow for it to more rapidly heal, which is a benefit. It allows for a greater coverage, so you can use this in combination with a split-thickness skin graft to enhance the healing potential of the wound and allow for the patient to experience a much decreased time to closure. It does allow for a reduced length of stay in the hospital. This has been shown in burn patients, and it can reduce their length of stay by upwards of 50% for certain burns. And just the fact that you need less donor skin, if you're a very large burn patient or a large trauma patient, it can allow for additional skin sites so you can treat a much larger surface area, skin grafting alone or in isolation for sure.
While it wasn't an approved treatment till recently, Valerio first came across RECELL in 2010. He was in the military treating wounded soldiers in the Afghanistan and Iraq wars.
It was actually invented by Fiona Wood out of Australia actually in the 1980s. So it's something that has actually been around for a while, but it actually wasn't in the U.S. markets until investigational trials and around the time frame of when I started utilizing it. I actually had a clinical grant in a trial that was actually done through the military, through the DoD, in order to treat wounded warriors that had substantial skin loss, where we wanted to see if spray skin could be an alternative for treating some of their blast and trauma and burn-related injuries.
Valerio says the technology hasn't changed much since then. Once a small piece of healthy skin is retrieved, it's put into an enzyme that breaks it down into individual cells.
You then put into a buffer solution that can then be sprayed onto the human body in order to treat the soft tissue injury defect that you're proposed treating. When I first started treating wounds with this kit, it was actually what we call point of care kit. So it came in its own individual box kind of container. It had a heating element that was used to actually heat up the enzyme so that you can then put the skin graft into it. Then once a 20 to 30 minute period had transpired and it was ready, we would then scrape it, put it into the buffer solution, and apply it to the patient.
Earlier this year, a new kit was released that streamlines this process even more for physicians. While Valerio believes this technology is the future of skin grafting, he thinks there needs to be more awareness and education around RECELL so that physicians are comfortable adopting this new practice. You can find more information about Dr. Ian Valerio, Jenna Pothier, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.